However, the doctor also recommended that Trump lose some weight as part of maintaining his long-term health. The medical examination took place at Walter Reed Medical Center near Washington, D.C., and included a full physical checkup along with diagnostic testing. But that's not the only headline involving Trump today. A federal judge in Miami has reopened a lawsuit involving Trump's Internal Revenue Service, or IRS, records. The case centers around a massive $1.8 billion settlement agreement with the Justice Department. Judge Kathleen Williams decided to take another look at the case after a bipartisan group of 35 former federal judges urged the court to review the settlement more closely. The decision could bring renewed attention to one of the most closely watched legal matters involving the former president. What do you think about these latest developments? Let us know in the comments below. And don't forget to like, subscribe, and turn on notifications for more breaking U.S. news updates. A major change could be coming to childhood vaccines in the United States. President Donald Trump has signed a new executive order that could lead to a major review of the nation's childhood vaccine schedule. The order directs the Centers for Disease Control and Prevention, or CDC, to examine recommendations from a recent Health and Human Services report. If those recommendations are adopted, several vaccines currently recommended for children may no longer be included in the routine schedule. The vaccines that could be affected include those for hepatitis A, hepatitis B, meningitis, rotavirus, seasonal flu, and COVID-19. Supporters of the plan say the goal is to bring U.S. vaccine recommendations more in line with some other developed countries, and to focus on vaccines that have broad international support. However, critics strongly disagree. A group of 15 states with Democratic governors has filed a lawsuit challenging the proposed changes. They argue that reducing vaccine recommendations could make children more vulnerable to preventable diseases and place additional strain on healthcare systems. Medical experts have also expressed concern. Some public health specialists warn that lower vaccination rates could increase the risk of outbreaks of diseases that have been largely controlled for years. They point to recent measles outbreaks as an example of what can happen when vaccination levels drop. The debate has quickly become one of the most closely watched public health issues in America. Supporters say the changes are about reviewing scientific evidence and updating recommendations. Opponents argue that the current vaccine schedule has helped protect millions of children and should remain in place. The CDC and its advisory committees are expected to review the recommendations in the coming months. What do you think? Should the United States change its childhood vaccine schedule or keep the current recommendations? Share your thoughts in the comments below. And don't forget to like, subscribe, and turn on notifications for more breaking health and policy news. A new report is raising serious questions about the impact of the shutdown of USAID, the U.S. government's main international aid agency. According to Dr. Atul Gawande, a surgeon and former USAID global health leader, the loss of U.S. aid funding has already contributed to hundreds of thousands of deaths around the world. Gawande cited research suggesting that USAID programs helped save millions of lives over the past 2 decades by fighting diseases such as HIV, tuberculosis, malaria, and polio, while also helping reduce child malnutrition and maternal deaths. Now, he says the sudden loss of funding is creating a growing humanitarian crisis. One estimate mentioned by Gowand suggests that more than 600,000 people may have died since the shutdown of major USAID programs. According to the analysis, many of those deaths involved children. The report highlights concerns that cuts to health services, vaccination programs, and food assistance are leaving vulnerable communities without critical support. One heartbreaking example comes from a refugee camp in Kenya. A mother named Ravana Nabi was forced to make an impossible choice. Her young daughter was receiving treatment for severe malnutrition at a clinic, but Ravana learned that her other children at home had gone days without food. She decided to leave the clinic and return home to care for her family. Tragically, her daughter died the following day. Medical workers at the clinic said no parent should ever have to face a decision like that. The debate over USAID remains highly political. Supporters of the aid programs argue they save lives, improve global health, and help prevent humanitarian disasters. Critics have questioned government spending and the effectiveness of some foreign aid programs. As the discussion continues, the human impact of these decisions is becoming a major topic of debate both in the United States and around the world. What do you think? Should the U.S. restore large-scale foreign aid programs or focus more on domestic priorities? Let us know your thoughts in the comments below. And don't forget to like, subscribe, and turn on notifications for more breaking news and health updates.